Hey athletes, it's Dr. Jackson from the Sports Pod, and today I want to talk about disc herniations, so in particular lumbar disc herniations. So I'm not really going to go into too much about necessarily like how to treat this or anything, just kind of the basics of what a disc is, what is a herniation, the different stages of it, etc. So let's talk about the disc first. So you have bone, disc, and it basically repeats that pattern throughout your entire spine. Now the disc is what we call a shock absorber, and it has a couple of different layers. So, I love food, I'm a foodie, and so I like to basically describe the disc as a jelly-filled donut. So you have a soft kind of jelly center, which is called the nucleus, and then you have this kind of more fibrous, tough outer layer called the fibrous annulus. So essentially a disc herniation is when the center material starts to work its way out. So depending on whether or not you've had any trauma to the area, maybe you have weak abdominals, or you do a lot of twisting and compression of your spine, those are some things that might make you a little bit more predisposed to having a lumbar disc herniation. But just because you do those things doesn't mean you're going to get one. And even if you have a lumbar disc herniation, doesn't necessarily mean you're going to be symptomatic. So if you find one on an MRI, don't just be like, oh, that's it, that's my problem, and kind of go from there. Actually try to determine the root cause of the pain and go from there. But I don't want to get off on that tangent. Let's talk about the different stages of a disc herniation. First, you're going to have just degeneration. So the disc will start to kind of lose its water intake. It'll start to maybe compress and lose some of its height. Also, it'll start to weaken a little bit. And then that nucleus on the inside can kind of start moving around a little bit more. And then the second stage is actually going to be the disc bulge. So this isn't that minor, but depending on where the disc bulge is, it can be. But essentially the fibers, the annulus fibers around the outside of the disc start to weaken. And then that inner layer or the jelly of the disc start to migrate out and create a bulge. So depending on where that bulge is, you can actually have like radiating pain down the back of your leg. You can have, maybe irritation of a nerve root in that area, maybe even cause, some localized swelling and edema if the irritation is great enough. But the third stage is going to be where actually the inner nucleus actually breaks through completely of that outer fibrous layer, but the nucleus still stays intact, okay? And then a complete kind of, sequestration, which is going to be the fourth kind of stage, which is going to be the worst, is where actually like a piece of that nucleus breaks off and it becomes dislodged like within the spinal canal. So that's definitely the most serious case. I'm 100% sure, if you had that presentation, you're going to be feeling, some pain and be in quite a great amount of discomfort. But having said that, that's essentially in a nutshell the 4 stages of a disc herniation. Hope you learned something from this, guys. If you feel like you've got some low back pain and there's something going on and, you want to get it checked out, then come see me at the Sports Pod. Feel free to contact me via social media. That should be down here in the left-hand corner. I hope to hear from you soon, guys. Have a good one and move free.